If you are a nursing student and you are ready to pass Nclex, I have an Nclex challenge for you. Are you ready for it? Here is your Nclex challenge. Yes, tonight, ReMar Nurse University Class 2 starts at 8 p.m. Eastern Time. I'm challenging you to this 2-hour class. Tonight's class is 2 hours. We are going to be doing deep studying, and you guys know the deep studying is where it counts. And so these are all the topics we will be talking about. And I'm going to tell you a little bit about the topics for your Nclex challenge. But I have to remind you right now, there is a huge, big sale on the Nclex virtual trainer. It is $200 off, and that is for the entire system. Yes, that is for the entire system for preparing for Nclex. And so just a little bit, because we have a lot of new people who don't know what the virtual trainer is. So with the Nclex virtual trainer, you get your book plus online lecture. It's a success program. It is a complete, comprehensive test plan overview to help you get your license. And so the reason why we have the physical books, the quick facts for Nclex, you guys know I always talk about that for nursing student, and the virtual trainer student workbook is because these are better than just downloaded ebooks that you may or may not print out, that you might lose pages to, that you don't have in one place. Shout out to Savoya says, it's amazing. Yes. And so we provide those physical books as well as your computer house of lectures and your content. Okay, so it's books plus content, and you can watch it. I'm saying computer, but you can watch it on your cell phone. You can watch it on your tablet. You can watch it anywhere you can get the internet. And so these are better than just question banks where you're just getting questions or, just ebooks. You also get the daily study calendar. You get your homework. Your online program comes with homework. It comes with practice exams. It comes with lectures. It comes with activities plus the 2 books. And so this is the best program I've ever created for repeat test takers and international nurses. And right now, during ReMar Nurse University, I'm taking $200 off of this entire system. So I want to motivate you that if you have not started your virtual trainer and you think you're going to get your license, all right, in the next couple weeks, get into it because it will help you significantly improve your chances. And so right now, again, big sale, go to remarnurse.com for the Nclex virtual trainer package. Yes, I want you to have the package. And I'm challenging you guys tonight because we have R and U coming, and I'm gonna answer your questions. You can actually find your daily study calendar in the file vault. So your file vault portion right here of your Nclex virtual trainer, get your daily study calendar there. You can get drug cards. It's all included for you in the virtual trainer. All right. Hi there. So tonight I'm challenging you. I'm calling this the challenge yourself because we have deep studying tonight. Get your snacks, get your workbook out. We are going over pain management. All right. So if you have any issues with these topics for your Nclex, you want to jump in. We're going to go to pain management. We are going to talk about acute versus chronic pain, the different types of symptoms that a patient can report. Also, we're going to be talking about treatments for pain, right? And so we're going to talk about acetaminophen toxicity. We're going to talk about how you treat it. Acetaminophen is something that so many people take. Right now, if you've ever taken acetaminophen for pain, or if you've ever given it to your children for fever or teething or anything, just tap in, right? And also hemodialysis. What we're talking about the toxicity of this very common medication. How does hemodialysis play a role in it? We're going to talk about NSAIDs versus aspirin. What are the differences? We're going to talk about the drug interactions for aspirin. Super important because this is another medication that you can purchase over the counter. And that means that you do not need a prescription for it. Yes, so tonight, ReMar Nurse University, set your alarms 8 p.m. Eastern time. If you are not in Eastern time zone, just convert it Google it, whatever you got to do, but get there. Shout out to all my international nurses watching. We are talking again tonight. This class is fire. It's 2 hours. We're also going to talk about weak versus strong opioids. Do you know the difference? Nclex, you need to know the difference, okay? The difference between addiction, physical dependence, and tolerance. They are not the same things. We also are going to push deeper and get into psychiatric medications. And psychiatric medications are by far the most challenging to understand and to memorize. So we're going to talk about some. Valproic acid is one of it. Do you know, is valproic acid, is it a fast acting or a slow acting? Do you know? Do you know? If you know, put it on the comments. We're going to talk about MAOIs, SSNRIs, and SSRIs. And I rarely talk about SSNRIs. So you want to be in tune for tonight's class. And then we're going to follow it up with substance abuse. So, hey, this is ReMar Nurse University. This is how we do it. Every Monday, we are studying pharmacology during ReMar Nurse University, okay? And so tonight's class is a 2-hour class. And I want to challenge you guys. I want to challenge you guys to make this commitment, because if you can sit in a class for 2 hours, that is going to mentally prepare you for when you go in there and take that exam, because that exam can be a 3-hour, that exam can be a 4-hour experience for some of you. And we have to discipline ourselves. We have to train ourselves to be able to maintain stamina, maintain interest. And so if you can do this with pharmacology, you can do this with any subject that Nclex throws at you on your actual test day. So let's dig in. Let's challenge ourselves. Let's get it done. It's Monday. So this is your Monday motivation. If you want it bad enough, you will do it. If you want this bad enough, you will make the sacrifices for it. You will set your alarm. You will have your workbook printed out. You will be there on time. I will be there waiting for you guys. So I'm just trying to see who's going to show up, who's going to make the commitment to themselves. All right. This is the year you say you want to get your nursing license. I'm challenging you to get it. So again, tonight's class, all about pharmacology, and it's a ton of pharmacology again. Shout out to Nurse Crystal. She says, I just passed my Nclex. Thank you, ReMar, for Nclex. Amazing. I always love when I go live and I'm talking about Nclex and somebody says, I just got my license. That is the entire reason why we do what we do at ReMar Review. It is the entire reason for just one person to get their nursing license. It's life-changing. It's life-changing. So tonight, challenge yourself. Again, this is the basics. All right. RNU class tonight at 8 p.m. Challenge yourself. The class is 2 hours. 2 hours long. Okay. So it's stamina time, pain management. We're going to talk about acetaminophen toxicity. We're going to talk about NSAIDs versus aspirin, drug interactions. I'm looking forward to tonight too. I'm so excited about it. Weak versus strong opioids, addiction, physical dependence, tolerance, yes, and those psychiatric medications. And I'm not just going to talk about one. I'm going to go in and give you a great breakdown of these 4 listed here. And then we're going to get into substance abuse from the virtual trainer. So this is what it's all about. Also, for you guys who are just tapping in right now, huge sale right now on the entire Nclex review program that I created. So if you are testing this month, if you are testing next month, this is the time to get it. We only drop this price like this during ReMar Nurse University. So we're taking $200 off. It's $169 right now, the virtual trainer. So head over to remarnurse.com and take advantage of this sale. You don't need a coupon code. You don't need a secret discount, nothing. That is the price. We dropped it. So I want to see you there. But most importantly, I want to see you in class tonight. Yes. See you guys later. Remember, you can, you will, and you must pass Nclex.